And two, some tobacco products like smokers, when they smoke, they are likely to have gum problems, and gum problems is also another source of this bad breath. Today's question came from a lady. She said we should not disclose her name, and like she asked about the causes of bad breath. So bad breath, which is medically known as halitosis, can be as a result of so many causes. One, it can be as a result of what we call oral microflora. There are bacteria which are present in our mouth, which after we eat food, the remaining food particles inside that remains inside our mouth, they come out to eat it up. So as they are eating, they are excreting. As they are eating, they are excreting. So they are excreting a volatile sulfur compounds which has a rotten egg odor, which will be perceived as bad breath. That is one. And two, some tobacco products like smokers, when they smoke, they are likely to have gum problems, and gum problems is also another source of this bad breath. And number three, after we've eaten, our saliva pour out from the salivary gland in order to wash away all the food particles. So in a condition called xerostomia, which is the dryness of the mouth, this saliva will not be enough to clean all the remains of food particles in your mouth. So the remaining food particles can also lead to this bad breath. This dry mouth naturally occurs while we are sleeping. That is what leads to morning breath. It is not pleasant, and it is even worse when you are sleeping with your mouth open. And also, poor oral hygiene can lead to this bad breath, because if you are not brushing your teeth frequently, like daily, there is what we call bacteria plaque. That bacteria plaque can form on the surface of your teeth, and with time it will be creating irritation to the gums. At the end of the day, it will create a pocket within your gum, which will lead to what we call periodontitis, and that can lead to accumulation of such bacteria in that pocket created, which will later lead to this bad breath. And your tongue can also trap this odor creating bacteria. So oral hygiene can also take care of such bacteria. And there are some medications that when taken, they contribute to the reduction of saliva production, which later leads to dry mouth, and dry mouth will lead to this bad breath. And also surgical wounds after the removal of tooth, like as a result of tooth decay or any gum problem, such surgical incision can get infected. Surgical incision can trap bacteria, which will later lead to this bad breath. So the best thing for you is to go to the hospital and see your doctor. Thank you.